My name is Dr. Stephan Parker. I'm an orthodontist and I practice in Mayfield Village, Ohio. I've been practicing orthodontics for nearly 30 years. We treat all ages of patients. We have young patients, we have teenagers, and we have adults. And we are in the business of creating healthy and beautiful smiles. Infection control is very important in our office. We really want to make sure that we are providing a clean environment for our patients, whether it be washing our hands with the proper soap and water or using hand sanitizers. It's important for patients to realize that the CDC has special hand guidelines for dentists. They have determined that using hand sanitizers can be much more effective than washing our hands. Not only does it kill more bacteria, but it also protects us by not drying out our hands, causing chapped hands and cracking. I think our clients appreciate that we use PURELL. They notice the quality, the name brand. They know that we're trying hard to provide them with the best quality infection control in our office, and part of that extends to how we clean our hands. And we also provide those dispensers in our waiting room. PURELL hand sanitizer is not like any other hand sanitizer I've used. It's much more comfortable to rub on my hands. It leaves my hands feeling more silky and smooth, and I'm definitely experiencing less chapped skin, less need to use hand moisturizers. It's really an amazing formulation. The staff really appreciate having PURELL in the practice. They like the dispensers. They feel that the quality of the product is way beyond anything we've used before. It's readily available. Whether they're walking to or from any area, it's easy to dispense some hand sanitizer, and the overall response has been incredibly positive. We have a dispenser in the waiting room. Patients use it all the time. I think they feel really good about having PURELL dispensers, and they know we're serious about hand hygiene. Our hand hygiene regimen follows standards set by the Ohio State Dental Board. The State Dental Board has determined that it's not necessary to wash our hands between each patient. It depends on the procedures that have been done and the amount of soil. Many times, instead of using hand soaps to wash our hands, which oftentimes cause drying and chapping of our hands and create cracks, we use hand sanitizers. I always make a point to use PURELL in front of the patients. The patients really want to know that we are taking care of their health, and by showing them that we're using a quality hand sanitizer like PURELL, they know that we care about them. I would highly recommend my colleagues, other dental professionals, use PURELL in their office. Not only are you using a brand name that's been tested and shown to be most effective, but their patients will realize that they really care about the quality of their infection control in their office. It makes a huge statement to the patient, and I think patients really appreciate that, and it'll go a long way to help their practices grow.